Let me welcome you to the 2015 KVC Health Annual Meeting. Thank you for being here. I'm a little bit of a nervous wreck today. Look at the size of this room. I mean, so look at this. This is, I think, the biggest crowd we've ever had. The biggest crowd we've ever had for this event. Sometimes we do it at breakfast, sometimes lunch, but biggest crowd ever. I think what the story there is, you build a bigger room and more people come. So thank you for helping us build a bigger room. So thankful that you guys are all joined us today. Did start out with a little Let's Go Royals. I look around the room, you might notice there is a little bit more blue around the world today, right? A little more royal blue, nothing wrong with that, right? And it's fun to get caught up in all the excitement of the Royals. It's the second year in a row that we've had this meeting during a Royals participating in the World Series. And if you're like me, you get caught up in all that excitement and emotion and passion of the Royals, and you probably laughed a little bit, you cheered a little bit. And if you're like me, and you guys know, some of you people in the room know me, you might have cried a little bit too along the way. So I think, looking at the agenda for today, by the time we're done today, I think we might touch all of those emotions for you today, and that'll be my goal. So my name is John Barnes. Real quick, if I haven't had a chance to meet you, I have the honor and privilege of serving on the executive board of KVC, which is truly an honor, and done that for several years with a great group of people and great leadership of KVC. And so this is one of the duties that I get assigned, so I'll do the best I can, Randy. All right. So you think about that passion that the Royals have. I mean, it takes an unbelievable amount of passion to do what KVC does. Do you guys all remember what the mission of KVC is? It's to enrich and enhance the lives of children and families. That's what they do. And it takes an unbelievable amount of passion to get that done, to have the outcomes that KVC has. This past year has brought about a lot of exciting changes to KVC. Much like the baseball team, having great experience and tenure is a competitive advantage, but also having young, fresh, innovative insights from new players is also a competitive advantage, and you're going to hear a lot about that today. As we have watched over the last few years, our executive team mentor a number of new leaders that are coming into very key positions with KVC. So their fresh insights and their passion and their talent, as a board member, I've been able to watch some of them develop, and I can tell you they're an unbelievably talented team that you're going to hear a little bit more about later today. KVC has 1,300 employees across the country. Anybody know that? 1,300? 1,300 employees across the country that help KVC have become an international leader in child and family health. And they're really known for that now. Their knowledge and expertise is a vital part of the Living, Breathing KVC Institute, part of our new expansion for health systems innovation. Public agencies, private sectors, and even foreign countries now come to or contact KVC for advice and counsel in their expertise. You'll hear a lot more about that as we go. KVC has many accomplishments. Part of our purpose today is to share many of the accomplishments and celebrate them. But none of them would be possible without the staff, the major donors, the sponsors, the partners, many of whom have been, if you've seen their names pop up there. There's no way that KVC could do what they can do without those names and many of you in this room. We are so honored to have you as our friends. We treasure your commitment to strengthening families in the states that we serve and beyond. And we thank you from the bottom of our hearts for all of us at KVC. Now, before we get too far into this thing, I know that everybody has one of these in their pocket, right? And it's okay if you check it along the way. In fact, you can actually play with it today if it's okay, right? Because what we want you to do is feel comfortable talking about and sharing our celebration today in your social circles, right? So we want you to tweet or text or post something on Facebook about today's celebration. In fact, on the back of your program, there is some instructions for sharing your posts and photos using the hashtag #PeopleMatter. For those of us maybe a little bit older like me and a little less socially smart, hashtag I think is that thing that we used to call a number sign. And now they call it a hashtag. But if you haven't already done so, please like KVC Health Systems on Facebook, follow at KVC Kids on Twitter and Instagram, and feel free to share and retweet our posts throughout this afternoon's program. So let's get today's celebration started. Please help me in welcoming up to the podium KVC Ombudsperson Dr. Jackie Suttington, who will deliver our invocation.
Good morning. Will you bow your heads as I pray? Inspiration, influence, vision driven. Lord, we thank you for the opportunity to serve the children and families you have given us. Thank you, Lord, for dedicated board members, employees, friends, and partners. Today, as we think about the things we think about, let us surmise profitable thoughts, thoughts to inspire others, thoughts to influence others, and thoughts to lead us to our destinations. Lord, we thank you for 35 years of unparalleled leadership, leadership that stayed on course, not with just great ideas, but with God ideas, with a culture that all people matter. Amen.
Thank you, Jackie. As many of you in this room know, KVC's mission is to enrich and enhance the lives of children and families. So the question is, how do we do that? And really the question is, why do we do that? So I'm going to start with how we do that. And I think many of you know this, but so how we do that is through services that include foster care, adoption, in-home family therapy, behavioral health care, and children's psychiatric hospitals. In fact, the only 2 psychiatric hospitals in Kansas are KVCs, and many states don't even have them, unfortunately. We seek to stabilize and strengthen families at the most vulnerable time, to protect and heal children who have experienced abuse and neglect, and show those who feel overwhelmed that their lives matter. And no matter how tough the circumstances is, they can overcome them. So that's the why we do that. Why we do it? It's really simple, because people matter. That's why we do it. I want to share with you a short, quick video that shares some of KVC's accomplishments over the past year.
Last year was a banner year for KVC. We were able to positively affect more people than ever in our history. Here are a few statistics. We directly served over 59,000 children and families and indirectly touched the lives of tens of thousands more. Provided in-home therapy and support to nearly 27,000 children and adults, helping to keep families together. Supported 6,561 children in KVC foster families. Helped 485 children and adoptive parents find each other. And this is just a small bit of the good news. We employed over 1,300 dedicated staff, traveled over 4.2 million miles, and provided thousands of hours of training, all to better serve children and families. More importantly, we were able to grow while still adhering to our core values and remaining financially strong. In our children's psychiatric hospitals, children reported that KVC was safe and respectful, and they had a positive experience. Through our consulting program, we've reduced the number of children changing foster homes and safely reunited families faster. We also reached into international territory last year, showing leaders in other parts of the world how to achieve results like ours. We continued partnering with leading organizations including New York University, the Annie E. Casey Foundation, the Federal Administration for Children and Families, the University of Kansas, and Child Trends to advance 4 major research projects, plus dozens of state and local partners across the U.S. Last year, KVC enriched the lives of more children and families than ever before by leading the nation in revolutionizing child welfare.
What do you think? Needless to say, it's been a pretty good year. 60,000 people, more than 60,000 people, were impacted directly in one way or another by KVC. 60,000, let's put that in perspective. So think about it. We're talking about the Royals, how excited it is. You've been to any of the games, you watch it on TV, you see that crazy stadium. Well, its capacity is 38,000. So imagine if you took that stadium, almost doubled it, right? Filled it, every seat full, and you felt that same passion. That's how many people KVC has touched just in the past year, right? And those people are, every group. They are children and families, but also seats would be filled with relatives and educators and coaches and mentors and foster parents who are heroes, judges, social workers, state government officials, relatives, doctors, nurses, the list just goes on. So KVC has had a very, very, very good year. In order to generate positive outcomes and experiences for so many people, KVC constantly looks to innovate. That's probably one of the strengths of KVC. They are constantly innovating to find the best way to provide services and make the most impact. For example, a couple examples. The MyLink program. The MyLink program has equipped over 1,000 foster families with iPads so that they can directly connect to therapists and ongoing education via video. Just one example. Another example, the foster parent training curriculum, which is the first of its kind in anywhere, it provides the latest proven effective trauma treatment approaches to relatives and foster parents. So using innovation and technology is something that KVC has become very good at, and is one of the reasons why they are so successful. We also continue to share evidence-based practices with state governments, universities, and juvenile justice systems in order to reduce the number of children and youth entering congregate care, out-of-state care, or juvenile detention centers. And that's a big point I don't want to gloss over, because one of the core beliefs of KVC, and we talk about it all the time, is that we know children live and grow best in families. And that's what KVC does so well. They connect families, because not only do they know that, but they live it and they breathe it every day. And that's why they're successful. KVC is also focused on using neuroscience to understand how toxic stress affects the health and well-being of children and families. Our institute and KVC hospitals were among only 15 organizations selected to lead efforts to align public policy with the latest science in order to move the needle on difficult social issues like poverty, substance abuse, family discord, trauma, and physical and mental health challenges. And we were just talking, we had a board meeting earlier today, we were just talking about the impact of substance abuse and how much it impacts everywhere, and children especially. We're proud to say that our approach is working and our results are getting noticed. You can learn more about the innovative work of KVC in the 2015 annual report, which you can find online at www.kvc.org/2015 report. So, with that, I'd like to introduce and bring up to the stage probably the person that more than any other impacts all those positive results, the CEO of KVC, Mr. Wayne Sims.
John's a tough act to follow. So thank you, John, for doing what you've been doing today. You know, I thank you all for being here today, being with us at our annual meeting. It's very important for our staff and families to know about this meeting, and they will see lots of pictures of the meeting today. You know, in every major city, there are enlightened citizens who can identify needs within a city, within a community, and then work to improve those needs. Our honoree today is certainly one of those individuals who works to make our city a much better place for us to live within. I, along with many others over the past few years, have had the opportunity to observe our honoree and see how his involvement has truly improved our city, the entire metropolitan area. Our honoree today, receiving our KVC Hero Annual Award this year, is Bob Rainier. Bob is here with his wonderful wife, Ann, and a number of folks affiliated with Bob's banking interests. I should say that Bob and Ann have 3 wonderful children and what I would a little bit envious of. They have 7 grandchildren. He's got 4 on me, so I'm very envious. Bob is a native Kansas City and has been a director, president, and chief executive officer of the Blue Valley Bancorp and the bank since formation in 1989. He's also been the sole director, president, chief executive officer of Blue Valley Investment Corporation since 1995, its inception, and the Blue Valley Bancorp Building Corporation since its formation in 1994. So, in other words, I would say Bob is a very successful man. You know, over the years, I've had the privilege to meet and know many successful people, but I would say it's very unique to find one as enlightened as Bob. He has been on numerous boards and has been the chair of most of them, if not all. I could not begin to identify all the organizations, projects that he has been involved in over the years, but if you would permit me, Bob, I would try to list a few. Some of the boards he has served on includes areas of his interest in education. He's been on the board of directors of the Blue Valley School District and the Johnson County Community College. He is supportive of the arts. He works with the Civic Council of Greater Kansas City, Union Station, Greater Kansas City Foundation, and remember, he spends most of his time being a successful banker. But he does this in his past part-time. I looked up the definition of a hero, and a hero is a person who is admired for great or brave acts or fine qualities. Today, we are honoring Bob for his fine qualities, if not his great acts. I would be remiss if I did not mention how honored we are at KVC to be one of the organizations Bob has touched. Please join me now in recognizing our KVC Annual Hero Award, Bob Bernier. And Bob, you may not want to hold this while you're talking, but this is for you.
Thank you very much.
Thank you, Bob.
Wow, that was my mother couldn't have done a better job than that. But I'm very sincere when I say I'm very honored by this recognition. I mean, particularly coming from this organization. And this is a wonderful organization, and you know, gives me a chance to sort of reflect on the heroes in my life. And you know, I thought about this for quite a while, and trying to think of something that was worthwhile and was, you know, beneficial and had a message to it. But I do have a number of heroes. My dad, and who really, and a young man by the name of Henry Block, who I had the great opportunity to work with down at UMKC, and both people, espouse the necessity and the importance of hard work, integrity, and reinvesting in the future. But you know, when you stand back and look at it in a broader sense, and I don't want to parse words, but I was thinking about the heroes and being heroic. Johnny Cueto was heroic on Wednesday night. But you know, when you look at heroes, and when you look at it in a much broader sense, the impact on being able to impact people, particularly people that don't have a lot of control over their lives, like children. To me, that's a reflection of heroes. And you stand back and look at the people that accomplish that, like the teachers, people with Head Start programs, people in daycare, and foster and adoptive parents. Those are all people that affect children that really have no control over their lives and are dependent on someone assisting them to that next level until they can get to to adulthood and to a place where they would have impact in their own lives. So when you really look at under that broader definition and that broader reach, everyone that works for the KVC organization is a hero in my eyes, and I think everyone in this room's eyes. So when you look back at that and you look at the whole body of work of KVC, 35 years, and again, Wayne, we talked about earlier, 35 years, from 5 people to 1,300 people, from a budget of $200,000 to in the millions, and impacting not thousands, not tens of thousands, hundreds of thousand people over the span of its existence. That's a pretty amazing thing. And again, from my little, understanding, again, I try to read what I can and understand the organizations that we support. But, you go back and it seems like the underpinning of this organization is really very basic, very simple. It's not treating a child like a unit of measure. It's not a measurement unit. It's an individual. It's a child that deserves to be in a family environment as opposed to a warehouse on a shelf someplace waiting for the appropriate time for them to be adopted or something else. So, I have to personally stand back and think, this organization, we wouldn't be here today. This organization, this building wouldn't be here today without Wayne Sims. Wayne Sims was the guy that, there's always somebody at the top that has to lead the organization and has to create the direction and guide people along the way. And, if there's a hero in this room, it's Wayne Sims. So I am so appreciative of this. Thank you very much. This is a great honor for me, and I appreciate being recognized today. Thank you very much.
This is a big screen that you get to walk behind. Just wonder what people do when they're back there as they're walking out there. If you haven't already seen our newest building, or addition to this building, I'm sure you have now today, but if you haven't had a chance to go through it or go around it, I would encourage you to do so. We dedicated the building in May. We were able to do it through the generosity of so many wonderful people. Many of you are in this room have assisted with that. We are delighted to have a new executive director for our institute. Her name is Sue Lorbach. She was a researcher that we were very much involved with, following her research and trying to deploy that, so much that we decided to go ahead and hire her. So she is here. We're pleased that she is here on staff with us. We're also delighted to have additional resources made possible through this institute. The latest and greatest technology to support our interactive therapy, to support our staff training, and you probably know that we're able to do a lot of staff training from here, but through all of our offices around the country, they're all able to take part in those trainings, initiate the trainings from there. We truly have wonderful equipment to allow us to do that, and we're very thankful that through this last campaign, we've really upgraded our technology, so we're very pleased with that. You probably saw in the video, but it went by pretty quickly, but in Kansas alone, we have one child, foster child, every day that's being adopted. We match a wonderful family with a child. We match the child with that family, and one child a day on average. And nationally, it's about 500 children that we are matching with those families. So this technology, just in that one area alone, goes a long way to helping us increase what we want, what we think is important. We also have expanded teleconferencing capabilities. The Ball Center, the conference center here has been expanded so we can house larger groups here for trainings. We're very, very pleased with that. So this is what we call our institute, our Innovations Institute, but really Our institute is without walls, and it has to do with our more than 1,300 employees across the nation, that through them, the training that we do is without walls. Even though we have walls here, they are there representing this institute at that location. We recently launched our Big Idea campaign, sharing our vision for transforming foster care in America. And I'd like to share a video with you now featuring many of the KVC leaders speaking on this video as they try to improve and strengthen struggling families and vulnerable children. Can we get the video going?
There's 400,000 children in the nation that need homes, and
some people have a notion that it's negative, it's just bad kids, but it's not. It is kids who have a right to happiness.
For me, one of the biggest challenges that trauma poses is that it has the potential to rob a child of their future.
The child doesn't deserve to stay in foster care. The child doesn't deserve to sit there and wonder what's coming next. They start questioning themselves. What did I do?
Families carry trauma throughout their lives and they pass it on to their children, and unfortunately it then gets passed on to their children.
But across the nation, you do see an over-utilization of medication with this population. I think it was last year, about mid-year, that I saw that a number of infants were even being prescribed psychotropic medication. That is kind of unbelievable.
Those kids really don't have those avenues. They don't have a support system. They don't have anyone saying, here's your next step. I'm going to be there for you in your next step.
Many states kind of release young people at the age of 18. They kind of have a birthday cake for them, if you will, and then they're on their own.
Who do they have in their life that they can go to? Where will they go for Christmas? Who will be kind of that one person that will help them with major life decisions?
I think KVC's big idea is to keep kids in families, period. We have intensive family preservation services throughout the country. We're focused on providing in-home therapy to children and families. So if services are implemented quickly and effectively with the family in partnership, then the need for out-of-home removal can be prevented. A child's time is different than an adult's time. For a 4-year-old, 2 years is half his life. And so we have to operate with that in mind. We have to understand that we need to move quickly, that every day a child is outside of his parents' home, or every day that a child is at risk, is a very long time. Keeping kids in their families or with their relatives, or at least in their own home communities in a foster home, those things are important because kids need to feel safe and secure in order to thrive. And if they're in situations that are unfamiliar to them, they don't feel stable, they feel unsure, they don't feel secure, and they can't progress. We bring in researchers and trainers to come present the information to our staff, and then sometimes we partner with those researchers to think about ways to tie their research and their work into child welfare practice specifically. By managing with data, we track anything that we possibly can. We know how long the children are staying in our care. We know the average amounts of times before reintegration can occur or before an adoption can occur. And as we watch those things and we see progress, we really dig into what's working or what's not, and then we adjust our practices based on those things. At KVC, we've implemented some systems so that we're monitoring the psychotropic medication that's prescribed to our children. We have a database, and in real time, when our staff are visiting with children, they're entering any medications the children are prescribed. And then our system is set up to alert our medical director and child psychiatrist, as well as other leaders within the organization, if there's any concern. That way we understand what the child is on, whether we need to have it reevaluated, because we don't want children to be on psychotropic medication if they don't need to be. I think any number of children in the foster care system is too many. I understand, I know that there are children that unfortunately do need to be removed from their homes for a period of time. But I think the ideal would be that we find a way to serve all children and families in their home settings. And if they need to be out of their homes, they should be out of their homes for as short a period of time as possible. We want foster care to be a temporary solution. When a child is out of his parents' home, he is placed with a family who is feeding him breakfast in the morning and getting him ready for school and taking him to appointments, and who is also there to talk with the child about the things that are going on in his life. And so including them as part of our team as we work with the family to talk about what they need in order to have the child return home, or to look at options for permanent adoption for a child if that's the way it's going, it's critical to include them because they are around the child more than anyone else at that time. 30,000 children age out of foster care in this country every year. I don't think anyone leaves a home at 18 years old and is prepared to respond to every issue that comes their way. A flat tire, a checkbook that won't balance. Most of the young people in this country can call their parents or a grandparent, and often these kids who are aging out of foster care don't have that option. So we have a responsibility to create that for them.
If we blame the system and we blame it on politics or we blame it on the government or we find other excuses not to help a single child, then we're just perpetuating that problem and we're allowing that cycle of trauma to continue.
What we've found is that by addressing a child's trauma, more often than not, we're getting to the heart of why that child is having some of the challenges that they're having.
You really want to approach every child, every situation, every family as if it were your own.
We spend a great deal of time in our institute looking at latest research and then trying to apply it in our families and the work that we do.
With the infusion of technology, it makes staying close to families and children much more accessible. We're able to see children face to face on a daily basis if that's what we need to do.
We affect change in the system by changing the system radically, working ourselves out of jobs, understanding very clear when we are successful, our work will change.
We will have a far greater reach if we can take what we know here at KVC and expand it to other systems.
So KVC's got a big idea. Did you catch it? Huh? Let me quote Erin Stuckey on there. Right? She said, the big idea is keep kids and families, period. She said it pretty forcefully too, didn't she? You know that thing we said earlier about some of the great young staff that's been being mentored over the years? You saw some of that in this video, and it's just the tip of the iceberg. This organization has more talent and people with more passion than every one of us that operate in a business or work in a business should be jealous of the kind of talent this organization has. And they attract great talent because people are passionate about what they do and they feel the success that it has. So that's the big idea. Just keep kids and families, right? I'd like to also share my congratulations with Bob and thank you for all your support. Well, there you are. Thank you for all your support. So we're going to move into the last phase of the program today, and this is a very special part of our program today, and I think you'll feel the meaning of that in a second. But to get us started with that, I want to introduce my good friend and the chairman of our board, Mr. David Ball.
Thank you, John. Speaking of trying to find young talent, I remember when I was on the board and I was trying to recruit John Barnes, and at that time he was working for Pepsi. He was the president of Pepsi here in the Midwest. So I said, John, you want a few more ads this year in the stores? He said, yeah, I'd love to. I said, well, you're going to be joining KVC's board because we need your help. So that's how we got John Barnes on board. So John, thank you so much for emceeing this. I will tell you one advantage of being the chair of KVC is that I'm able to hand out roles and responsibilities and do a little delegation. So John, thanks for the great job you're doing. I also want to congratulate Bob and Ann. Congratulations on your award, and couldn't happen to a better couple, and I know Ann is the one that drives Bob to the kind of man he is. This organization was founded by women, and we know the strong influence they have on our organization. And we want to welcome you to the KVC family. So congratulations again. Thank you. My mother and the junior league ladies got together and saw a real need in Kansas City, Kansas, in the early '70s, and they started. They bought a house. Didn't know how they were going to buy the house. They said, "Well, we'll just do it. And we'll figure out how we're going to pay for it later." And they went back home that night and got their husbands to write a little check, and so they bought this little house, and it had 5 beds in it for at-risk boys, and that's kind of how KVC's started. Wayne, could you come up here for a minute, please? Also, one of those founding ladies is here this afternoon, and she happens to be our very first chair, and I believe she hired Wayne Sims. Betty Crooker, could you stand up and be recognized? Also, I want to take a moment and recognize the folks that support me so much with this organization is my board of directors. Could you all stand up and be recognized, please? So then came Wayne. So Betty, actually, we didn't have a budget back then, so I think Betty ended up getting a little U-Haul and hired Wayne and moved him back here to Kansas City. And we kind of called this Wayne's World. When Wayne moved in, we called it Wayne's World. So truly been an amazing past 35 years. Through his leadership, KVC's grown from a single home in KCK into an international network system providing child welfare, behavioral health care, training consultation services across 4 states and also in Washington, D.C., as far away as Canada, New Zealand, and like what we learned this morning, Singapore. Wayne actually has a vision for the board is he wants to eliminate all the orphanages in Singapore over the next several years. So that's a huge undertaking. Again, it's just a testimonial to his vision and leadership. And of course, the board says, we're all in, let's go. Also has grown from the small ladies from the junior league in KCK to, as John said, 1,300 plus associates. And we didn't really have a budget, didn't know how we were gonna make ends meet. And our budget now is approaching $140 million, and so we really have big aspirations to continue to grow that budget and looking for support. Through Wayne's leadership over the years, couldn't tell you how many families, children that he's impacted lives, even if you're not having challenges in your own life, he's affected my life in such a positive way I couldn't even begin to explain. For me to list all of Wayne's accomplishments today, we would be here well into next week. Wayne has spent decades building relationships within our community and other communities that he's served. His impact has been so tremendous that it's earned a national recognition, receiving an endorsement by the Annie E. Casey Foundation, which is probably the #1 foundation in the United States for national best practices. It's kind of like getting the presidential award when you get something from Annie Casey, and Wayne received that award on behalf of KVC for child welfare. Again, it's very difficult to put in words the admiration, appreciation, and respect that not only I have, but I'm sure all of you in this room have, the many board members that have served your vision, a man that has dedicated his last 35 years, night and day, working to make life better for children in Kansas City and across the nation. He's guided the development of KVC in the culture, developed the culture, and it's very, very simple how Wayne puts it. He always challenges all of us, and a lot of you have heard this and will continue to hear this. What would you want for your own child or your family? And then you can answer that question. And then here's another one he likes. Excellence is not an act, but it's a habit. And so on behalf of all of us, Wayne, we're going to show a little video. So I want you to go down there and get with Sherry so you can watch this video. It's coming up. So walk around there. And then I'm going to give you the podium here in a minute. And then we're going to have a little celebration for Wayne. So anyway, could we roll the video?
When I began, it was not uncommon for young people to remain in foster care for years and years. In fact, I've seen a number of young people spend their entire childhood and adolescence in foster care. Maybe having 20 or 30 different placements, which is tragic and very traumatic for the young people who are there. What would you want if this were your child and your child had to enter a system? You probably would not want them to spend 2 or 3 years of their childhood growing up in a foster care system. Neither do we. Sometimes when children or adolescents come into care, you get caught up in the system. However, if we can turn that picture, if we can turn that page, if we can look a little more in more depth about the need of that child, and if we focus on that, if we focus on helping them to become more self-sufficient, giving them the tools they need, I think what you'll see are those young people taking advantage of that. Many states kind of release young people at the age of 18. They kind of have a birthday cake for them, if you will, and then they're on their own. Our focus is to try to get them through that system as quickly as possible, and then to support that family once the child goes back home. Our focus is to bring the youth in, work with the family immediately, work with the child immediately, and do whatever we can to get them back into a home as quickly as possible.
So, with that said, Wayne Sims is retiring after 35 years. This is one hell of an organization. Wayne is one hell of a guy. We couldn't have done it without him. He has built this organization. Wayne, thank you so much. We're so proud of you.
Those of you who know me know that I'm going to choke up here in a little bit if I haven't. So just bear with me and go with me. I didn't know about this film, so Rennie, you and I are talking about this later. I knew that something was going to happen. I didn't know exactly what. So that video went by pretty quickly. Did you notice? It's kind of like the 35 years that I've worked here seem to go by almost that quickly, if not that quickly. But it's certainly been my pleasure to be at the helm here at KVC for 35 years. You don't hear that too much anymore, 35 years as the CEO of someplace. But it's truly been my honor and my pleasure. And I think with privilege comes responsibility. And as you looked at the people on that tape earlier, the big idea video, you saw some of the folks that we have across the country. And I don't know, Brent Lemon from West Virginia is here. Brent, would you stand up just a minute? Did anybody recognize his video and the video? Did anybody recognize that accent that he had? So actually that's a West Virginia and Kentucky team back there together. You know, to be successful in anything, you have to have a team. You have to have folks who are going to work together and to be there. And I saw Secretary Phyllis Gilmore here earlier. She may still be here somewhere. I just wanted to say thank you. Thank you, Secretary, for being here today. She's the Secretary of Department for Children and Families here in Kansas. And gratefully, we've had wonderful leadership over the years to be able to work together. And not only here in Kansas, but I'm thankful for the leadership we've had in other states, Nebraska, Kentucky, West Virginia. We've worked with leadership in Washington, D.C., their CFSA group, and we just so appreciative of that. But I tell you, internally, if you don't have a team works together, you're not going to be successful. So first of all, I need to recognize my lovely wife for being so supportive over the years. She could have easily been not supportive, but thankfully she has. And I have two grown daughters now that they were wonderful, and I have to say they were very motivational. And I had a lot of learning experience from them, especially when they were in their adolescence. So I don't know if any of you have adolescents or have, if you have children and they get to adolescence, you'll appreciate what I'm saying. You know, I guess I want to say, first of all, how appreciative I've been for the opportunity to work with the board members that we have over the years. We have had such wonderful people to step up and help with that. And you met David Johnson, there was up here earlier, but David Ball is a great example of that. He is so interested and wants to do the most he can for children. And he is a legacy member. Both his dad and mom, some of you may have known Fred and Joanne Ball, but they've been involved with this, and his whole family has. But both Fred and Joanne have actually chaired, and Dick Bond has co-chaired had been a past chair and worked with him. And I would say of the people who really have, that I've looked to as a mentor as I have been here when I first came to Kansas from Iowa. It took a while to get an understanding of what was. And Fred Ball was just an absolute wonderful friend and a mentor, and I would say the same thing about Dick Bond, who continues to be willing to mentor me and to be there for KVC. Betty Crooker was here. Betty and I have a lot of memories, and we're not going to share them, Betty. We had some hard times and some good times, but wonderfully. You know, in addition, you know, no one's an island. No one does things by themselves. Maybe the best thing I have done in my life is to be able to recognize talent and bring people in and put them in the right positions. And sometimes you have to move them around a bit to get the right position, the right fit, the right position on the bus, if you will, and then the right seat on the bus and those kind of things. So, but I would like to just say that if you had the opportunity to meet our leadership in Nebraska, if you had the opportunity to see what they do, in every one of the states we are in, they may not have started out very big, but I can tell you that in every state they're either the largest foster care provider, largest family preservation provider, largest home-based therapy. We take therapy into the homes and try to keep the child in the home without them being removed, but if they are removed, how do we get them back and then do family therapy there? We don't have them come into an office 4 weeks from Thursday to come in for therapy. We go into the home where they're there. And our team in Nebraska, they have a wonderful, there's an ism that that the state, or I guess they coined and the state uses a lot, is that we don't sleep until you do. And so children who come in late at night and are gonna be in somebody's office, in the state office, unless our folks are there, and they are there, and they place every child referred to them. And in Kentucky, I can't tell you the dynamic leadership we have there, and the talent in Kentucky is unbelievable. Many of you know our Kansas group, the Kansas Permanency Contract Group. They are superb, and most of the folks who've had a chance to go through that have gone on to do other kinds of things in other locations. And I'm so excited about our psychiatric hospital team. You know, I have a chance to be on panels and to consult in a lot of different states. I have never yet found a state that, as a child hospital, child and adolescent psychiatric hospital, accept every child referred to them by that state. Now, I can tell you we work with states that have as many as 400 children placed out of state, leaving as early as 5 and 6 and being placed out because they have behavior problems, which is absurd. We work very hard to prevent that, and West Virginia has some contracts now to bring those kids back. So if you had a chance to meet these folks and these different subsidiary organizations, you would be totally impressed, and you would say, gee, I wish I had them working for me in my business. They are top quality people. And of course, then on a personal level, there's a group that surrounds me that does everything they can to make me look better, make me look well more intelligent than I am. First of all, I have to acknowledge Joyce White, wherever she is. She is truly the excellent executive assistant. I could never have asked for anyone better or more competent to work with me. And I don't know that if you all know this, but Sherry Love, our Chief Clinical Officer, Paul Clater, our Chief Financial Officer, Ann Roberts, the orange pumpkin-like person over here. Together, we have an average of 26 years of leading child welfare in Kansas and across the nation. We have worked together, teamed up, to look at how to improve things for children and families, no matter what the need. And I could tell you stories that would break your heart about 8-year-olds trying to commit suicide, this horrible kinds of things. But we have the dynamic team that stands in place, ready to work with no matter who the child is, no matter what the issues are, or what's wrong with the parents, or what's wrong with the system, but they are there. And I would say you will never find a more dedicated person than our Chief Financial Officer, Paul Clater. He is tireless. He is constantly there. I have certainly appreciated him over the years. I would say Sherry Love had a funny kind of, she focused on research and looking at the latest and greatest research. That's how we got connected to Glenn Sachs, who's head of child and adolescent psychiatry. We bonded with them over the years, and I've had the privilege of working with Glenn now, and our team has. In fact, that's why we're in Singapore. They saw some of our folks present at UCLA, the Child Trauma Network, and they came back, and they've now sent about 30 people from Singapore to work with us over here. So we've had some wonderful folks there. But I want to say, Sherry Love went out and she called it stalking those people who have created that research. She stalked them until they would come back and visit with us here, and then we hooked them when they came back here. And so we've had, she was a great stalking person. And I would say Ann Roberts, I don't know what there is to say about Ann. She is absolutely the best there ever was and ever will be Chief Operations Officer. You know, you can have all kinds of great ideas, but if you can't figure out how to deploy them into the community, it doesn't matter whether you have the ideas or not. And she's able to take those things and break them down into bite-sized information and get them out. Now, clearly, across our network, across the country, I tell you that those folks don't need smaller bites. They understand and get it. But Ann is a great teacher, and I don't think we would ever be where we are today without her leadership. She is absolutely wonderful. So I'm probably leaving out people I should have said something about, but that's just the way I am. I tend to do that, I guess. But I just want to say that if you think about 35 years, and it's been a wonderful opportunity for me to have that 35 years and to be here, and I'm very thankful of that. With privilege comes responsibility, and I've tried to be as responsible as I could in growing this organization. It has been a true blessing for me. But as I leave, I want you to know that we are not skipping a beat. We're still going to drive hard for children and families across this country. And I have to tell you that I have done some mentoring with my replacement, as we have, and every one of our chief operations officers, financial officers, clinical officers, they all know who the replacements are going to be, and they've been working with them for years. So we're not going to skip a beat. People know that. They're going to come into place. And our board has identified these people and agree with it. And you saw some of them on this last screen. But I am very pleased. I think the gentleman who's coming in to replace me, I just have the utmost respect for. He's a very talented, competent man that has been so gracious to me to have me send him out to another state somewhere and work for a while so he'd get a flair for that, and send him across the state, and now put him over our hospital system. He's been able to do that and handle each one of those exercises with great skill. Let me introduce you now to my replacement coming January 1, Jason Hooper. Would you stand up, please? Couple things real quickly. I've been here for 35 years. There's no way he's going to be able to be a CEO for 35 years. He's been here 20 years or so, so he'll beat that, but never as 35 years as CEO. You know, I just want to say thank you to all of you who have allowed me this opportunity to be here. I appreciate that very much. It's truly been an honor for me to serve in this role, and I will continue until last day of December. As I've told Jason, until the last day of December, I'm going to be the CEO. January 1, it's all on you. So just let me say in closing, I thank you all for allowing me to be in this role. I thank you for your support over the years. I really have appreciated it. And there's really only one thing left I can possibly say, and that is, go Royals. Thank you all.
Hey, Rennie, we are right on time. And in 35 years, or how many of these speeches I've heard, the only time Wayne's ever been on time is his last time. Come on, how many times have you guys heard him go on for I'm thinking 35 years, you can talk as long as you want, man. I would just like to say thank you for letting me ride along. Man, what a ride, what a pleasure. I've said it before from this podium, I'll say it one last time. I've never met anybody in my life that has as much passion, as much vision, as much risk tolerance, but still understands how to execute. That's a skill I wish we all had. So thank you so much. Thank you guys all for being here today. We've had another great year in 2015. Congratulations, Jason. He's ready. I'm telling you, the guy's ready, and he's going to have a good team around him. Mr. Sims, thank you very much. You know, he said you didn't have to be as supportive. You had no less choice than any of us. We just do what Wayne says. Pretty much. I bet you had more influence on him than this board has had. I bet you. All right, everybody, I want you to have a great day. I want you to leave here. We're not all going to be Wayne Sims. In fact, probably none of us are going to be Wayne Sims. But you can do something to help children and families. if you ever want to consider being a foster parent or adoption, if you can't do that, be an everyday hero. Or if you do nothing else, just leave here and go tell everybody that lives, people do matter. People matter. Just say that. Just say that on behalf of KVC. People matter. Have a great day. Thank you guys for being here.